Hello everyone, Dr. Kent again here, and this is the lecture on movement. The objectives for this lecture are, at the end of this lecture, the student learner will be able to describe the physiology of exercise, identify the physiological effects of exercise, state the psychological effects of exercise, and identify the types of exercise. Physiological response to physical activity. Voluntary exercise encompasses many elements beyond simple muscle contraction. Volitional effort generated in the motor cortex of the brain drives the spinal cord to recruit motor units, resulting in specific movement patterns. In parallel with neural signals to the skeletal muscle, there are also powerful neural feed-forward signals to the cardiovascular, respiratory, and metabolic and hormonal systems, along with neural feedback from the contracting skeletal muscles that generally permit metabolic demands to be met with limited disruption of homeostasis. As you can see from this picture here, physical activity affects many body systems. In the central nervous system, there's regulation of physiological responses to exercise through somatic and automatic systems. Cerebral blood flow and oxygen supply are well maintained. With the metabolism, there's increase in glucose output, mainly from glucogenolysis, but also glucogenesis. There's increase in adipose tissue lipolysis and free fatty acid mobilization. That is what FFA stands for, free fatty acid. In the skin, there's increased in sweat rate, and there's also major effects on fluid homeostasis, cardiovascular function, temperature regulation, and metabolism. With the oxygen transport system, there's an increase in oxygen uptake, increase in heart rate, and increase in ventilation. In the skeletal muscle systems, there's increase in ATP turnover, increase in glycogenolysis, glucose uptake, lipolysis, and free fatty acid uptake. There's also an increase in utilization of oxygen and carbon dioxide and heat production, and there's increased in blood flow. Exercise is medicine. In 2007, the American College of Sports Medicine, with endorsement from the American Medical Association and the Office of the Surgeon General, launched a global initiative called Exercise is Medicine to mobilize healthcare professionals and educators to promote exercise as a way to prevent, reduce, or manage disease and impact health and quality of life. Physical activity as medicine has its roots in ancient civilizations, and there is a global agreement with a recommendation of 150 minutes of moderate to vigorous physical activity a week. A recent 2017 systematic review demonstrates that there is evidence of dose-response relationship between physical activity and primary and secondary prevention of chronic medical conditions and premature mortality. There are also marked health benefits with relatively minor volumes of physical activity. Even individuals who are inactive or have cardiac disease get the most benefit with small bursts of movement. Exercise safety and warnings. Even though physical activity or exercise has many important health benefits, there are occasions when it could exacerbate or trigger health problems. Chest pain, shortness of breath, or dizziness during activity could mean an impending cardiovascular event. Individuals experiencing any of those three symptoms that are out of the ordinary should stop exercising until they are evaluated by a healthcare professional. There are also musculoskeletal injuries that could be triggered by over-exercising or trying new activities when individuals are not prepared to perform them. Joint injuries, stress fractures, muscle strain are the most common. Exercising in hot environments without replenishing of fluids electrolytes could lead to health-related illnesses such as renal, gastrointestinal, and cardiovascular events. Adolescents with eating disorders may use compulsive physical activity to lose weight or maintain an unhealthy weight and could lead to severe health consequences. Individuals could experience overtraining when their physical efforts and recovery times are unmatched and have the following health effects: physical burnout, fatigue, hormonal dysfunction, rhabdomyolysis. Rhabdomyolysis is a breakdown of muscle tissue that releases a damaging protein into the blood. This muscle tissue breakdown results in release of a protein called myoglobin into the blood. Myoglobin can damage the kidneys. Also, what can happen with overexercise is impaired metabolism, poor immunity, increased cardiovascular stress, decreased performance, and chronic injury. It is important to discuss recommendations based on an individual's preference and health conditions, as well as follow up with individuals who are starting or increasing their physical activity to prevent these side effects. Slow the effects of aging. Regular physical activity is one of the most powerful interventions we have to slow the effects of aging. Some of the effects include improved cognitive function, improved mood and sleep, lowers the risk for cardiovascular disease, decreases hypertension, improves diabetes, decreases obesity, decreases the risk of breast and colon cancers. It helps the immune system fight infections, increases energy, and it improves the quality of life in general. This quote on the slide I love. It reads, "When it comes to health and well-being, regular exercise is about as close to a magic potion as you can get." Physical inactivity. In 2010, the World Health Organization identified physical activity as the fourth leading risk factor for global mortality. Globally, 1 in 4 adults is not active enough, creating one of the leading risk factors for death worldwide, and over 80% of the world adolescent population does not meet the suggested guidelines for physical activity. Additionally, insufficient physical activity is a key risk factor for non-communicable diseases, while physical activity shows significant health benefits and helps prevent non-communicable diseases such as cardiovascular diseases, cancer, and diabetes. How can we as healthcare professionals help our patients and communities be physically active? This lecture will bring you up to date with definitions for physical activity and exercise. We'll review the recommendations for adults and special populations and identify the steps to develop exercise prescriptions to fit the needs of individual patients. Through an integrative lens, we will also understand the complexity to support individuals to be physically active, though not only providing appropriate recommendations, but also through motivating them to move, assure access to safe places to be active through political action for creating infrastructure and urban planning, and providing physical education in schools and access to sports and other opportunities for children and adolescents. The burden of physical inactivity. In the most recent self-reported data from the CDC about physical inactivity in adults, participants were asked, during the past month, other than your regular job, did you participate in any physical activities or exercises such as running, calisthenics, golf, gardening, or walking for exercise? For those who answered no, the lowest score was 16.4% in Colorado, and the highest was 32.4% in Kentucky. In other words, folks in Colorado appear to be exercising more than folks in Kentucky. Sedentary jobs in the United States have increased about 83% from 1950, with less than 20% of jobs including physical activity. Physical inactivity or sedentary behavior is an independent factor to increase the risk of cardiovascular disease. There is a continuous nonlinear dose-response association between sedentary behavior and risk for cardiovascular disease, with an increased risk for cardiovascular disease with more than 10 hours of sedentary time. Physical inactivity is also related to all-cause mortality. Diabetes, mellitus type 2, and cancer of the colon, lung, and endometrium cancer are higher in this group of people who are not physically active. It is not only important to discuss with our patients how to meet the weekly goal of a minimum of 150 minutes of moderate to vigorous physical activity, but also to pay attention to how many hours we sit every day and how to incorporate active breaks when at work. Who are the more physically inactive? Women compared with men, adults ages 65 and older compared with adults ages 45 to 64 and 18 to 44, Hispanic American, Indian Alaskan Natives, and non-Hispanic Black adults compared with non-Hispanic white, multiracial, and Asian adults. Adults ages 25 and older with less than a high school education compared to those who are college graduates. Adults ages 25 and older with annual household income below $25,000 compared with adults with an annual income of $75,000 or more. The burden of morbidity and mortality associated with preventable disease risk factors is significant. Modifiable behavior risk factors could be identified as the leading cause of mortality. For example, in 2000, the actual causes of death in the United States were identified as tobacco, 435,000 deaths, physical inactivity or poor diet led to 400,000 deaths, alcohol consumption led to 85,000 deaths. Lee et al. Conclude that the effects of physical activity globally on non-communicable disease prevalence estimated that 6% of coronary artery disease, 7% of type 2 diabetes mellitus, 10% of breast cancer, and 10% of colon cancer cases were caused by physical inactivity. Premature mortality as a result of physical inactivity accounted for over 5.3 million global deaths in 2008. Just by eliminating physical inactivity, life expectancy of the world's population would increase by almost 1 year. Many studies have focused on the health and economic cost of physical inactivity. In one study, in 2016, it was found that in addition to morbidity and premature mortality, physical inactivity may be responsible for $53.8 billion, that's billion with a B as in baby, dollars in healthcare systems cost worldwide. In addition, physical inactivity related deaths were responsible for 13.4 million of disability adjusted life years. Right now, I would like to define some of the terms we're going to use throughout this lecture. Physical activity is defined as any movement by muscles that results in energy expenditure above resting levels. Exercise is defined as a type of physical activity that involves planned, structured, and repetitive bodily movement done to maintain or improve one or more components of physical fitness. It is characterized by its modality, frequency, intensity, duration, and context of practice. Physical fitness. the ability to carry out daily tasks with energy and alertness, and includes cardiorespiratory fitness, muscular strength and endurance, body composition, flexibility, balance, agility, reaction time, and power. Physical inactivity is a term used to identify people who do not get the recommended level of physical activity. There's various ways that you can measure your physical activity intensity. There's the heart rate, the talk test, and rate of perceived exertion. Let's talk about the heart rate first. For moderate intensity physical activity, your target heart rate should be between 64% and 76% of your maximum heart rate. You can estimate your maximum heart rate based on your age. To estimate your maximum age-related heart rate, subtract your age from 220. For example, for a 50-year-old person, the estimated maximum age-related heart rate would be calculated as 220 minus 50 years, which equals 170 beats per minute. The 64% and 76% levels would be 170 times 0.64 equals 109 beats per minute, and the 76% level would be 170 times 0.76 equals 129 beats per minute. This range of 64% to 76% is based on the American College of Sports Medicine guidelines for exercise testing and prescription published in 2018. For vigorous intensity physical activity, your target heart rate should be between 77% and 93% of your maximum heart rate. To figure out this range, follow the same formula used above, except change 64 and 76 to 77 and 93. For example, for a 35-year-old person, the estimated maximum age-related heart rate would be calculated as 220 minus 35 years equals 185 beats per minute. The 77% and 93% levels of 185 beats per minute would be 142 beats per minute and 172 beats per minute respectively. This shows that vigorous intensity physical activity for a 35-year-old person will require that the heart rate remains between 142 and 172 beats per minute during physical activity. Generally, to figure out whether you are exercising within the target heart rate zone, you must briefly stop exercising to take your pulse. You can take your pulse at your neck, wrist, or chest. I recommend the wrist while you're exercising. You can feel the radial pulse on the artery of the wrist in line with the thumb. Place the tips of the index and middle fingers over the artery and press lightly. Do not use the thumb. Take a full 60-second count of the heartbeats, or take your pulse for 30 seconds and multiply by 2. Measuring physical activity intensity continued. Another way that we can measure physical activity is to use the metabolic equivalent, or MET. The metabolic equivalent is a unit used to estimate the amount of oxygen used by the body during physical activity. The harder the body works, the higher the MET. 1 MET equals the energy or oxygen used while sitting quietly. Any activity that burns 3 to 5.9 METs is considered moderate intensity physical activity. Any activity that burns 6.0 METs or more is considered vigorous intensity physical activity. Measuring physical activity intensity using the talk test. The talk test is a simple way to measure relative intensity. In general, if you're doing moderate intensity activity, you can talk but not sing during the activity. Some examples of this include walking at 3 miles per hour, water aerobics, bicycling slower than 10 miles per hour, tennis, ballroom dancing, general gardening. In general, if you're doing vigorous intensity activity, you will not be able to say more than a few words without pausing for a breath. Some examples of this include hiking uphill or with a heavy backpack, jumping rope, digging continuously, jogging or running, swimming laps, aerobic dancing, cycling more than 10 miles per hour. Measuring physical activity intensity using perceived exertion. Perceived exertion is based on the physical sensations a person experiences during physical activity, including increased heart rate, increased respiration or breathing rate, increased sweating, and muscle fatigue. Although this is a subjective measure, the exertion rating based on 1 to 10 may provide a fairly good estimate of the actual heart rate during physical activity. There is an actual perceived exertion scale that was developed in 1982 by the Swedish researcher Gunnar Borg. The RPEs, or rate of perceived exertion scale, runs from 6 to 20, with 6 being the least amount of exertion and 20 being the maximum level of exertion. The rate of perceived exertion scale is also used to measure the intensity of exercise and runs from 0 to 10, with 0 being nothing at all and 10 being very difficult. Types of physical activity. Research has shown that it is important to get all 4 types of exercise: aerobic or endurance, strength, neuromotor or balance, and flexibility. Each one has different benefits. Doing one kind of also can improve one's ability to do the others, and the variety helps reduce boredom and risk of injury. No matter your patient or client's age, you can find activities that meet their fitness level. Types of physical activity. Let's talk about the first type of physical activity, aerobic or endurance exercise. Aerobic or endurance is physical activity that increases the heart rate and the body's use of oxygen. It helps improve a person's physical fitness. Some examples include bicycling, walking, running, and swimming. The general recommendation for adults is to perform 150 minutes of aerobic moderate physical activity distributed throughout the week in bouts as short as 10 minutes per session. Alternatively, an individual could do 75 minutes of aerobic vigorous physical activity or a combination of moderate vigorous physical activity. Children and adolescents, the recommended activity for 3 to 5 years olds should just be physically active throughout the day to enhance growth and development. Adult caregivers of preschool-aged children should encourage active play that includes a variety of activity types. School-age children and adolescents, it is important to provide young people opportunities and encouragement to participate in physical activities that are appropriate for their age, that are enjoyable, and that offer variety. Children and adolescents aged 6 through 17 years should do 60 minutes or 1 hour or more of moderate to vigorous physical activity daily. Most of the 60 minutes or more per day should be either moderate or vigorous intensity and should include vigorous intensity physical activity on at least 3 days of the week. Muscle strength training. As part of their 60 minutes or more of daily physical activity, children and adolescents should include muscle strength training activity on at least 3 days per week. Bone strengthening. As part of their 60 minutes or more of daily physical activity, children and adolescents should include bone strengthening physical activity on at least 3 days per week. Physical activity for pregnancy. Women who are pregnant should do at least 150 minutes or 2 hours and 30 minutes of moderate intensity aerobic activity a week during pregnancy and the postpartum period. Preferably, aerobic activity should be spread throughout the week. Women who have habitually engaged in vigorous intensity aerobic activity or who were physically active before pregnancy can continue these activities during pregnancy and the postpartum period. Women who are pregnant should be under the care of a healthcare practitioner who can monitor the progress of the pregnancy. Women who are pregnant can consult their healthcare practitioner about whether or how to adjust their physical activity during pregnancy and after the child is born. Further guidelines include overheating, especially in the summer months and the first trimester of pregnancy. The increasing core body temperature may increase the risk of congenital malformation and miscarriage. Women that are consistently active during pregnancy may positively impact their infant's neuromotor skills. Women who are physically active have decreased risk of excessive gestational weight gain, gestational diabetes, gestational hypertensive disorders, preterm birth, cesarean birth, low birth weight. Some general precautions include women should avoid activities with high risk of falling or abdominal trauma, such as gymnastics, water skiing, or horseback riding. Downhill snow skiing is not advised due to changes in balance predisposing to injuries and falls, and contact sports such as hockey, basketball, and soccer are also contraindicated. Scuba diving should also be avoided because of the risk of decompression sickness. In the first trimester, women should avoid sustained, strenuous exercise in extremely hot weather, which could lead to a rise in core body temperature, as there are questions regarding the relationship between substantially increased core temperature and the risk of birth defects during this period of fetal development. Women with a history of preterm labor should probably avoid strenuous exercise during the second and third trimesters, although there is no definite evidence of increased risk. Women who were not at all active before pregnancy should speak with their healthcare provider about a strategy for beginning exercise to prevent injury and help with cardiovascular conditioning. Pregnant women who habitually engage in vigorous intensity aerobic activity or who are highly active can continue physical activity during pregnancy and the postpartum period, provided they remain healthy and discuss with their healthcare provider how and when activity should be adjusted over time. For breastfeeding women, be aware that neither acute nor regular exercise adversely affects the mother's ability to successfully breastfeed. Older adults. The key guidelines for adults also apply to older adults. In addition, the following key guidelines are just for older adults. As part of their weekly physical activity, older adults should do multi-component physical activity that includes balance training as well as aerobic and muscle strength training activities. Older adults should determine their level of effort for physical activity relative to their level of fitness. Older adults with chronic conditions should understand whether and how their conditions affect their ability to do regular physical activity safely. When older adults cannot do 150 minutes of moderate intensity aerobic activity a week because of chronic conditions, they should be as physically active as their abilities and conditions allow chronic medical conditions. Disabilities. The key guidelines for adults also apply to people with disabilities, and that there might be limitations based on their abilities. If not able to meet the guidelines, they should engage in regular physical activity according to their abilities and should avoid inactivity. Adults with chronic conditions or symptoms should be under the care of healthcare practitioners. People with chronic conditions can consult a healthcare professional or physical activity specialist about the types and amounts of activity appropriate for their abilities and chronic conditions. The benefits of people for exercising, for doing aerobic exercise include improves hypertension, improves glucose tolerance, decreases insulin resistance, improves dyslipidemia or cholesterol levels, decreases inflammatory markers, decreases visceral abdominal fat, decreases abdominal and total body fat, promotes weight reduction, and improves psychological well-being. Examples of aerobic physical activity by metabolic equivalence. Metabolic equivalence less than 3. Some examples of aerobic activity include walking slowly, less than 3 miles per hour, standing while doing light work such as cooking, washing dishes, or dusting, fishing, and playing most musical instruments. Some examples of aerobic activity that burn 3 to 6 METs include brisk walk, 3 to 4 miles per hour, heavy cleaning, such as vacuuming, mopping, and cleaning windows, biking, less than 10 miles per hour, ballroom dancing, pushing a lawnmower, gardening, doubles tennis, and golf if you're walking and carrying your own clubs. Some examples of vigorous aerobic activity that burns more than 6 meta-equivalents includes hiking, jogging more than 4 to 5 miles per hour or running, shoveling, cycling fast more than 12 miles per hour on a flat surface or in hills, basketball, soccer, tennis singles, and doing lap swimming. I don't know about you, but I was pretty excited about the vacuuming because I hate vacuuming, and at least I now know it's an aerobic activity. Maybe that will inspire me more to clean. Types of physical activity. Let's talk about the second type of physical activity, strength training. Strength or resistance training is a type of physical activity specializing in the use of resistance to induce muscular contraction, which builds the strength, anaerobic endurance, and size of skeletal muscles. This type of exercise could be done with just one's body weight or using free weights, resistant bands, weighted balls, stability balls, or weight machines. In other words, you are putting a force on your muscle, and your muscle doesn't care or know whether it's a band, whether it's a dumbbell, whether it's a machine. There's force on your muscle, and that makes your muscle contract. Isotonic resistance training, some examples include squats, bicep curls, etc., involves straining the muscles while moving the joint and applying a constant amount of weight. Isometric resistance, on the other hand, is holding the weight and not moving the joints. So if you're doing a wall squat or if you're doing a plank, that is an example of an isometric exercise. The American College of Sports Medicine guidelines for healthy adults recommends 2 to 3 non-consecutive days, and it's best to have at least 48 hours between sessions to allow the muscles to recover, and to do one set of 8 to 12 repetitions for all major muscle groups. It is recommended that you increase to 2 sets or more for each exercise, and you may go up to 15 to 20 repetitions for more advanced training to improve muscular strength and power and endurance. The amount of resistance should allow muscle fatigue near the end of the set. Some benefits of doing strength training include increased strength of muscles, tendons, and ligaments, reduce body fat and increase lean body mass, decrease glucose levels and increase insulin sensitivity, decrease blood pressure in patients with pre-hypertension or stage 1 hypertension, prevent and treat metabolic syndrome, increase bone mass and prevent slow progression or reverse osteoporosis, reduce pain and disability of people with arthritis, and it improves fatigue. Examples of resistant exercises by muscle group. So on this table, I have the major muscle groups listed. And again, remember, like I said earlier, your body doesn't know whether it's doing a dumbbell or a machine. Either way, there's force on that muscle, and the muscle's trying to contract against that force. So, for example, for the muscle group chest, a free weight exercise for strength is doing a supine bench press. For machine, you could do a seated chest press. For the back muscle groups, free weight example of an exercise would be bent over barbell rows, and a machine-based exercise for the back could be a lat pull down. For the shoulder muscle groups, a free weight exercise example would be dumbbell lateral raise, and for machine-based shoulder workout would be the shoulder press. For the biceps, a free weight exercise example would be barbell or dumbbell curls, and machine-based bicep exercise would be cable curls. For the triceps muscle group, free weight exercise, an example would be dumbbell kickbacks, and for machine-based tricep exercise would be press downs. For the abdominal muscle groups, free weight exercise would be do weighted crunches, and a machine-based abdominal exercise would be seated abdominal machine. For the quadriceps, free weight exercise would be back squats, and for machine-based exercise would be leg extension. For the hamstrings, an example of a free weight exercise would be straight leg deadlifts, and for machine-based hamstring workout would be prone leg curls. Types of physical activity continued. Let's talk about the third type of physical activity, flexibility training. Flexibility, also called range of motion exercises or plain old stretching, keep the muscles elastic and the joints moving freely. Flexibility exercises should feel like a comfortable tension and never pain. Some examples include yoga, tai chi, qigong, and stretching. And some of those exercises I just mentioned overlap. For example, in yoga, there might be some stretching in yoga. There's also some movement. Some recommendations. The goal of the flexibility program is to develop a range of motion in the major muscle tendon groups in accordance with individual needs. There is a decline in joint flexibility due to aging. Flexibility training improves transient joint range of motion and can have a more lasting effect when it is done consistently 2 to 3 times a week. When flexibility exercises are combined with strength training, they may enhance postural stability and balance. The benefits of flexibility training include increased joint flexibility, increased joint range of motion, and increased balance and stability. It is recommended to perform flexibility exercises with the muscle temperature is elevated actively through light, moderate aerobic or strength exercise, or passively through external methods such as hot baths or heat packs. In other words, you don't want to stretch cold muscles because that can lead to injury. Flexibility exercise targeting the major muscle tendon units such as shoulder, trunk, neck, lower back, legs, arms could be completed in about 10 minutes. Types of physical activity continued. Now let's talk about the fourth type of exercise, neuromotor exercise. Neuromotor exercise is sometimes called functional fitness training and incorporates motor skills such as balance, coordination, gait, agility, and proprioceptive training, such as yoga, tai chi, and qigong. It is recommended that people do 1 to 2 sessions a week, especially for older people. The benefits of neuromotor exercise include improved balance, agility, and muscle strength, reduces the risk of falls. Neuromotor exercise training is also recommended for athletes to prevent injuries and improve performance. Let's talk about one of the neuromotor exercises we mentioned in the previous slide, yoga. The definition of yoga is the integration of physical, mental, and spiritual energies that enhance health and well-being. Yoga is an ancient and complex practice rooted in Indian philosophy. Although classical yoga includes other elements, yoga as practiced in the United States typically emphasizes physical postures called asanas, breathing techniques called pranayama, and meditation, dhyana. What are the health benefits of yoga? Research suggests that yoga may help improve general wellness by relieving stress, supporting health habits, and improving mental, emotional health, sleep, and balance. It can relieve neck pain, migraine or tension type headaches, and pain associated with knee osteoarthritis. It may also have a small benefit for low back pain. It may help people with overweight or obesity lose weight. It can help people quit smoking and has been found to help people manage anxiety symptoms or depression. It can relieve menopause symptoms. It is a helpful addition to treatment programs for substance use disorders. It also helps people with chronic disease manage their symptoms and improve their quality of life. A 2007 survey by the National Center for Health Statistics and the National Center for Complementary and Integrative Health on adult Americans' use of complementary therapies found that yoga is one of the top 10 complementary therapy modalities used to support people's health. An estimated 6% of adults used yoga for health purposes in the previous 12 months. Access to yoga has expanded from local yoga studios to free access online and to real-time and recorded classes. I know I like to do yoga. I do the recorded classes on Peloton, or sometimes I go to live classes at the local YMCA. And sometimes if I'm looking for a new instructor, I just go to YouTube to do a free class. Neuromotor exercises, Tai Chi and Qigong. Tai Chi and Qigong are systems of slow, gentle physical exercise, often referred to as moving meditation. It consists of practicing deliberate sets of movements that gracefully flow into one another using deep and controlled breathing that results in different forms. Tai Chi was originally developed as a type of martial arts. These mind-body practices are complex and have a combination of the 4 types of physical activity, as the movements can be adapted to be done standing, walking, or sitting. The National Institute of Health summary of research on the benefits of Tai Chi and Qigong state that these modalities may help improve balance and stability in older people and those with Parkinson's disease. They may help reduce back pain and pain from knee osteoarthritis. They can improve quality of life in people with heart disease, cancer, and other chronic illnesses. It can ease fibromyalgia pain and promote general quality of life. Tai Chi also may improve reasoning ability in older people. In a 2016 systematic review of many studies on the health effects of Tai Chi, the following are conditions that could be positively improved with the practice of Tai Chi: hypertension, fall prevention outside of institutions, cognitive performance, osteoarthritis, depression, chronic obstructive pulmonary disease, pain, balance confidence, and muscle strength. High intensity interval training, or this is abbreviated HIIT. HIIT is one of the few exercises that incorporates all 4 types of physical activity. It includes aerobic, it includes strength, it includes flexibility, and includes balance. High-intensity interval training is a kind of physical activity that involves repeated bouts of high-intensity efforts followed by varied recovery times. The intense periods may range from 5 seconds to 8 minutes long and are performed at 80 to 90% of maximum heart rate. The recovery periods could also vary in length and are performed at 40 to 50% of maximum heart rate. The cycles of work and recovery are repeated for a total time of 20 to 60 minutes length. Research has shown that there are many physiological benefits, including improving aerobic and anaerobic fitness, blood pressure, cardiovascular health, insulin sensitivity, cholesterol profiles, and abdominal fat and body weight, while maintaining muscle mass. Persons who live a sedentary life or have high risk factors for coronary disease may need medical clearance before starting a HIIT or any other exercise program. HIIT has become a popular option for individuals who might have time constraints or physical or mental health limitations to exercise for long periods of time. In a systematic review in 2017, they compared the effects of high-intensity interval training and moderate-intensity training for improvements in body composition in overweight and obese adults, and found that both high-intensity interval training and moderate-intensity continuously training elicited significant reductions in whole body fat masses and waist circumference. There were no significant differences between HIIT and moderate intensity for any body composition measure, but HIIT required 40% less training time commitment. So what does that mean in English? It means basically HIIT is a good exercise to do if you're short on time and want to hit all those 4 components that I talked about: aerobic, strength, flexibility, and balance. I know I like to do a HIIT class on Tuesdays. It's a 45-minute class, but I get my aerobic in, I get my strength training in, bang, in 45 minutes, and I'm done. Aerobic versus anaerobic activity. Some of the exercises we talked about during this lecture involved aerobic activity, and some involves anaerobic activity. So I want to make sure we know the difference between both. Aerobic exercise is cardiovascular conditioning that strengthens both your heart and lungs. The word aerobic means with oxygen, as this kind of exercise is fueled by oxygen that you get from breathing. As you exercise, your muscles need more oxygen, which is carried by the blood, to keep going. This causes your heart rate to go up and makes you breathe deeply and quickly. While doing aerobic exercise, your small blood vessels get wider so that they can carry more oxygen to your large muscle groups like your arms, legs, and hips. When doing aerobic exercise, you should aim to do the activity for at least 30 minutes or longer a day. This kind of activity includes repeated continuous movement. Some types of aerobic activity including running or jogging, walking, swimming, biking, jump rope, stair climbing, dancing, and cardio machines such as the elliptical treadmill. What is anaerobic exercise? Anaerobic exercise is high-intensity exercise that's meant to be short and fast. Your body doesn't need oxygen as the source to keep your muscles going, but instead uses the energy that's already stored in your muscles. Anaerobic exercises are only meant to be repeated for 10 to 15 seconds, as these powerful movements usually can't be sustained for too long. Types of anaerobic exercises. The main purpose of anaerobic exercise is to build muscle mass. When following an anaerobic exercise routine, over the course of several months, your muscles experience hypertrophy. In other words, they get bigger. This causes them to increase in mass and power through stretching, contraction, and damage done to the muscles during exercise. Examples of anaerobic exercises include high-intensity interval training, weightlifting, calisthenics such as jumps and squats, and plyometrics. When you do anaerobic exercise, you push your body to work at your highest level of effort. Any activity at this level that doesn't carry oxygen to the muscles is considered anaerobic. To start an anaerobic workout, like with weightlifting, warm up for 5 minutes, either walking, stretching, or jogging. Begin by working your large muscle groups first, like your arms and legs. Do 1 to 3 sets of 8 to 15 repetitions. The weights that you choose should be heavy enough that by your last repetition, your muscles are ready to stop. Choose 8 to 10 different exercises to do. Afterwards, cool down by stretching. Barriers to physical activity. As a society, we are becoming increasingly inactive. This is not necessarily due to lack of information, but is often due to the multiple barriers and challenges of modern life. For example, when activity exercise programs are initiated, even young people may experience discomfort that may be discouraging. Other barriers may be confusion in understanding exercise recommendations or frustration learning a new activity. If physical activity becomes a chore or part of the to-do list, rather than an integral and enjoyable part of daily living, enthusiasm may also wane over time. Behavior change is a challenge, even for healthcare professionals. When environments or social situations are not supportive, change is ever more difficult. Physical activity requires complex, often demanding behavior change. How can we enhance the value of physical activity for ourselves? Perhaps highlighting the rewards of physical activity, such as good health, feeling energetic, increased endurance in sports, fewer illnesses, and lower medical cost. Common cited barriers include lack of time, social influence, lack of energy, lack of willpower, the weather, the air quality, for example, if there's too much pollen in the air or too much pollution, fear of injury, lack of skill, lack of resources, family obligations, and safety. Fundamental to integrative health is the concept of health promotion, placing emphasis on healthy lifestyles. Physical activity is a component of such a style of living. In this regard, healthcare professionals can motivate patients to create opportunities for them to be naturally active, such as walking or biking to work, taking the stairs instead of elevators, doing housework or gardening. In addition to considering a formula-based exercise prescription that has historically served as the medical community's approach to recommending physical activity. This is not to say that traditional exercise prescription does not have a role. Rather, it should be used as one of the several ways of recommending physical activity. Research supports shifting towards lifestyle-focused physical activity as it provides comparable health benefits and, more importantly, increases the likelihood of sustained behavior change. Another empowering intervention is to recommend working towards 10,000 steps per day. With most people having access to Fitbit or smartwatches and apps available for smartphones to count steps or distance with GPS, it is easy for many individuals to keep track of steps that add up through the day. In addition, timers could be set to remind us to stand up to break up our sedentary behavior. As healthcare professionals, we serve as a vital role in providing appropriate information to assist individuals in navigating the ever-changing seas of conflicting information and guidelines. Some questions that we as healthcare professionals need to ask is, what is the patient's past experience with exercise? What are the environmental barriers and motivators for engaging in this behavior? What medical conditions does the patient currently have, or is he or she at risk for developing? What does the patient hope to accomplish by becoming more active? What are his or her expectations? How might the patient naturally incorporate activity into his or her life's routines? These and other questions should be explored when encouraging a patient to make active living an integral part of his or her life. An important aspect of promoting physical activity living is the idea that health is dynamic. It changes throughout an individual's lifetime based upon their particular situation and underlying biology. Thus, any discussion about physically active lifestyles must consider varying approaches based upon individuals' particular life stage. That is, are they a child, an adult, a senior? Consistent with the guiding philosophy that integrative health engages the mind, spirit, and community, as well as the body, to stimulate the body's innate healing. Physical activity serves as a fundamental component of any health promotion plan. Integrative health also fundamentally challenges healthcare providers to examine and explore their own lives. Walking our talk allows us to more authentically role model the personal value of physical activity. Such modeling has been shown to increase a patient's willingness to follow through with activity recommendations and also has been shown to lead to better outcome measures. Promote activity safety. It's important as healthcare professionals that we encourage our patients and clients to stay safe when exercising. Patients or clients should wear loose, comfortable clothing and have good footwear. They should begin every exercise by warming up. They should be mindful of the weather, make sure it's not too hot or too cold, because this can put additional strain on the body. They should stay hydrated, whether it's hot or cold. Body fluids will be lost through sweating and respiration. They should watch out for pain, and there is a difference between discomfort and pain. And they should always be sure to cool down after exercise. Clients should stop exercising if they get dizzy or lightheaded, if they have chest discomfort, heart palpitations, nausea, a shortness of breath that's beyond their usual, pain or muscles in their joints, or if they have a headache during exercise. Conclusion. Physical activity has a positive effect on the body, mind, and spirit. Strategies to start or maximize physical activity should always be tailored to the individual and based on gender, age, abilities, fitness level, preferences, resources, and most importantly, to what is enjoyable and sustainable. The four main types of exercise are cardiovascular, strength, flexibility, and neuromotor activities. Most people can find one or more types of exercise they enjoy. Start with small goals and build strength and endurance gradually to avoid injury and exercise burnout. Many people could benefit from a physical activity makeover by learning how to change sedentary time into naturally active time. Good examples of this would be active commuting, such as walking or riding a bike to work, taking the stairs rather than the elevator, or using a standing desk. Parents and caretakers have an important opportunity to model enjoyable physical activity for their children with the integrative health model. On average, it takes 66 days to form a habit. During these first 66 days, or the equivalent of 9 weeks, patients really need our encouragement and support in order to participate in physical activities that they will enjoy for a lifetime. Promote physical activity. The following are example questions and suggestions to help patients be active and stay healthy. Help patients plan. Ask them, what are your goals? What do you enjoy doing? Do you want to exercise alone, in a group, or with a friend? What facilities are available? How much time do you have available each day or each week? What equipment will you need? How to be naturally active. Stand or pace while you are on the phone. And I do this a lot. When I have meetings that I'm just a participant and not leading, I will use my wireless earphones and walk around the neighborhood during a meeting. And I get so excited when I see other people doing this. Walk or putter after meals. Leave the seat at home when you go to concerts, games, outdoor activities. Try to meet in person rather than by phone or email. Create multiple workstations. park at the furthest spot, cook your own food, get up from sitting every 20 minutes, and walk for 2 minutes. These were the references that were used to make this lecture. Thanks for listening.